everyone to this next part of the anesthesia training series where I will be talking about CPR, or cardiopulmonary resuscitation. Obviously, and it goes without saying, for many people and many pets, CPR is such a bummer. We hope never to need to do it, but we always need to be prepared that it could happen, and we should anticipate this in any type of very sick, very debilitated patient. So today I want to talk about how we actually do CPR, some reasons why we end up in those types of situations, and what our goals of CPR are after it's finally over. Because whether we have a good outcome or we have a bad outcome, we just need to be prepared for the next time this situation arises. So I'm going to start off by talking a little bit about CPR itself, or why these things happen. So why do pets need CPR, or why do they arrest in the first place? There are so many reasons this could happen. So advanced disease is one of them. If your pet has a really bad disease that's been going on for a long time, the heart doesn't work, the lungs don't work, it has organ failure. If the body eventually gets to a certain point, it is not compatible with life. So advanced disease is one of them. Accidents and trauma. So we know lots of animals that come in have been hit by a car. Maybe they were in a house fire, or they were in some type of other various emergency. These can really put the body under a lot of stress and cause damage to the structure and the function of the organs. So these are some very common reasons too. Human error. We don't like to think about this one, but it happens to absolutely everyone. So I'm talking about things like drug overdoses, not giving the correct medication. If we're talking about surgery and anesthesia, maybe like massive amounts of uncorrected blood loss, or maybe we left the pop-off valve closed and now we have a problem. So there are many reasons, but these are just a couple. So we always go into things thinking, how can we prevent it in the first place? Because prevention is really the best type of cure, if you will. So what are some ways we can prevent animals from needing CPR? So one of the most important things, either during a tense situation or before we even get there, is assess the patient. So doing a physical exam, laying your eyes on the patient, laying your hands on the patient, and actually seeing what is going on is very important, because after you do that, you have an understanding of what's going on and you kind of have an idea of what might need to be done next. Monitoring. This is really important. So monitoring is not only important to get information about the patient's vitals, but also about their comfort and about how they're going to respond to treatments that either you as the technician or you as the doctor give to that patient. Treatments and stabilization. So after you found out there's a problem, administer timely treatments. So if your animal is painful, give pain relief medication. If they are struggling to breathe, maybe they need oxygen. Other things we could do would be diagnostics. So do you need more information to make a plan for this pet? Do you need blood work? Do you need radiographs? Do you need a consult from a specialist? So all of these are things you can use in your toolbox to help prevent problems before they start, because really that's the best way to do that. Okay, so let's say we've gotten in deep and we're getting closer and closer to a CPR type situation. What are some ways that we can best prepare ourselves and our staff and pets for CPR? So if you have a debilitated patient that's getting surgery, anesthesia, or is coming into the hospital, check the code status. It's always stressful in a CPR situation to go into the computer and find out the code status when you least have that amount of time. So check that in every single patient, every single time. Make sure the owner has signed those forms. That way you and the pet are protected. Make sure that you have realistic expectations when doing things to very debilitated animals. So if you have a patient that needs really invasive surgery, it has a lot of disease, I want you to think to yourself, will this animal be a successful CPR candidate? So CPR stands for cardiopulmonary resuscitation. It goes without saying that if the heart doesn't work and the lungs don't work, and you're going into that situation already, you may not have a successful CPR situation. And maybe it would be better for both you, the staff, and the pet to just make the animal a DNR instead. Obviously, that's not a choice in every scenario, and the owner may not elect that, but just have realistic expectations and think about what your goals really are. Delegating tasks is really important as well. If the patient is critically ill or you have already started CPR, try to recruit people and assign jobs early on. This way, you're not going to be overwhelmed, everyone has a role, and you're going to be able to provide timely interventions and make less mistakes. Asking for help kind of goes along with that as well. So when people offer their help, give them a job and see that there's not something you can do together. So let's say we're getting closer and closer to a CPR situation or we're already there. It really helps to have some of the drugs drawn up. So think about things like reversal agents, antiarrhythmics, blood pressure support drugs, things like that. So if you're nearing that situation, just go ahead and tell someone to draw those things up for you. I never think it's wrong if you have a very, very sick patient to wheel the crash cart closer to you. That way, you're ready, it's right there, and you can start working on it even before the arrest happens. So that's something I like to do, especially when I'm on call or in by myself, or if I have something very sick. I'm gonna draw up some of my life-saving drugs, and the crash cart is gonna be parked pretty close next to me. All right, so that's kind of the preamble to that. Now I want to talk to you a little bit about how we actually do CPR. So the first step is recognizing that there is a problem going on. So you've assessed the patient, you've looked at the patient, and we arrive at this point. So if you have a patient that is unresponsive, apneic, or not breathing, or if you're unsure if any of those things are happening, you should start CPR. So one of the most important things in starting the CPR process is timely compressions and timely intervention. If you're not sure and you can't really tell, you might as well just start compressions. So do that first. So the first stage is to start chest compressions. And this is part of a group of treatments called BLS, or basic life support. Compressions and ventilation are included in that. So the first thing you do is recognize, and then you start compressions. I want you to do this about 100 to 120 times a minute. So you can look this up on Google, pick your favorite song and sing it. And that way you're gonna keep it regular and keep the beat going, literally and figuratively. You wanna aim for compressing the animal at about half the chest width. This is obviously a pretty limited description of CPR, but if you go to the Recover website, you're going to be able to get a lot more detailed information. Ventilation, so it is appropriate to either give breaths to the coding animal 10 times a minute, or you can do a 30-2 method, which is where you give 30 chest compressions and then about 2 breaths. So I think it's easier for me to give 10 breaths a minute, but either is acceptable. So that's basic life support. So once you've done those, it's time to move on to advanced life support. And advanced life support encompasses things like drugs, defibrillation, and further monitoring, things like that. So you've started compressions and breathing for the patient. Now it's time to get some monitoring equipment on the animal. I want you to get all the pieces of monitoring you can on this animal, but try to focus on ECG, end-tidal CO2, blood pressure, and pulse oximetry, because these are the things you're going to be able to use to tell if your animal has responded to CPR. The next thing you need to do is get a catheter in this patient. And what I like to say is, if the animal is a CPR, it needs to have a catheter. So if you're doing sedation, if you're doing anesthesia, if the animal's a CPR, you need a catheter. Don't want to be messing around with that in this type of situation. You might as well just have it before. Vascular access and reversal agents. So you've already started CPR, it is okay to start giving reversals. So if you gave Dexmed, give some Atapam IV. If you had opioids given to this patient, give them naloxone. If you gave patients benzodiazepines, you can give them flumazenil. So get those reversals in as soon as possible, IV, after you have started basic life support and moved on to advanced. So we're going to do this cycle for 2 minutes. There's going to be one person compressing the dog or the cat, and then at 2 minutes, we're going to switch compressors, just so we don't get fatigued. And during that switch over, it should take about 1 or 2 seconds. You should have someone ready for that. And we're going to look at the monitor and assess the patient. we're gonna check our ECG and check our end tidal CO2, because this is the first point where we need to make another intervention. So during the switch, we're gonna have a look and we're gonna see what type of rhythm the patient has on their ECG, and this will determine treatment. So let's say we're having a good day. Let's say the patient came back. So that means we achieved something called ROSC, or return of spontaneous circulation. Usually you can tell this by the end tidal CO2 is very, very high. So as the heart starts pumping again, we're gonna get CO2 collected from the edge of the animal's body and pumped back out. So it's gonna go from very low because it was departed, and then it's gonna get very high. So return of CO2, maybe a sinus rhythm has come back on the ECG, and that it comes with return of palpable pulses, the pulse oximeter works again. It's important to remember that the ECG working alone doesn't tell you it's alive. It needs to come back with evidence of flow. So the CO2, the pulse ox, the blood pressure. So if you have ROSC, that's awesome. Now at this point, we need to make sure that the animal gets post-arrest care. So there is a complete post-arrest algorithm on the Recover website, and I would recommend looking at that. So if you get there, that's wonderful. Okay, let's say it didn't go our way. The patient is still not back with us. We can have one of a few situations. Check the ECG and check the rhythm. Ventricular fibrillation or ventricular tachycardia are two of the arrest rhythms that we can see in dogs and cats. They tend to happen much less often, but they're there. So if you see that, what you should do is continue compressions. So still continue compressions, and while you are doing that, get the defibrillator ready. So VFib and VTAC are two of the shockable rhythms, so that is how we treat that disease. So if you see that, you're going to continue compressions while another person gets the defibrillator ready, and then we do that. Now let's say your defibrillator doesn't work or it doesn't fire the charge when it's ready. You can also give them a precordial thump. So it is exactly the way it sounds. You're going to make a fist and kind of slam over the top of the heart on the side of the chest wall. This is of course not appropriate if the chest is open. And then in situations where that arrhythmia has been going on through multiple cycles, we can think about drug intervention, but it's very unusual. So let's say we see something like asystole or PEA, which is pulseless electrical activity. So asystole is a flat line doing absolutely nothing, and pulseless electrical can look like absolutely anything. And this is why you can't use an ECG alone to tell if the patient's alive. So pulseless electrical, it can look like a sinus rhythm, but maybe there's no pulses, the SpO2 isn't working, and the end tidal CO2 is less than 15. So that tells you it's still gone. So if you see asystole or PEA, this is not a shockable rhythm. You do not use the defibrillator for this. You treat this with drugs. So if you see this, you're going to continue compressions while you get drugs and give it epinephrine. So you start out with the low dose, and then in multiple cycles, you can consider high dose. So if you have been doing CPR for longer than 10 minutes, this is considered prolonged CPA or prolonged cardiopulmonary arrest. You can consider doing things like high-dose epi and possibly things like bicarbonate therapy, which helps to deal with the acid that is in the body during CPR. So to recap on a basic level, we have to recognize, and then we have to start. We're going to do compressions and ventilation, and then we're going to start monitoring the patient and getting vascular access. At 2-minute cycles, we're going to switch compressors, and we're going to give timely drug intervention, but we're not going to delay compressions. So it's really important that when you do that little switch over between compressors is just keep going after you've made your assessment of the patient while you're getting things like drugs, defibrillation, other things like that ready. So in between each cycle, we're gonna just repeat and switch compressors, and you just keep going until either you decide to stop, the owner decides that they would like to stop, or you achieve ROSC, which is great news. So we've done all that, we've done the hard work of CPR, and we either got the patient back or we didn't. There are a couple things we need to keep in mind and just think about when we're thinking about CPR. So The goals of CPR, it might be a little bit obvious, but let's go through that again. So it's great if you get ROSC, it's great if you get the patient back, but for many reasons, sometimes that doesn't happen, and that's okay too. And it's just important to recognize that. So if you do get ROSC, that's awesome. Make sure that you're providing appropriate care by following the post-arrest algorithm. The Recover Initiative has a lot of great information about this specifically. So this relates to pain management, nursing care, blood pressure support, and just optimizing the patient the best you can. If you're doing surgery and you achieved ROSC, then maybe at this point you stabilize the patient, but keep going with the surgery. So do keep going if it is at all possible. And then debrief with any outcome. So whether it's good or whether it's bad, it's really important to talk to your staff and your teammates about how we got into that situation, what went well, what didn't go so well, and maybe some things we can do better for next time. So that's CPR in a nutshell. Lots of things to do, but it's very well within your reach, and hopefully next time you'll be more prepared. And that's it.